I think people can understand the difference between content that is made from a medical expert and then patients being able to share their experiences through the comments, through, those means. And as I said, I really, in the end, think we need a place where both the physician expert and the patient experience is accessible and valued.
Hello, and welcome back to another week of Calling in Sick. I'm your host, Alex Wildison, and I've got Teddy with me today to introduce our guest episode. We have the amazing Dr. Erin Nance. You probably know her from TikTok. She is one of those viral medical personalities online. She just launched an app called FeelBetr, B-E-T-R, I believe. Link in the description below if you want to join, but her platform's amazing. It's basically like WebMD in a grown-up version, without AI hallucinations and without bogus diagnoses like you're dying. So if that sounds interesting to you, go check it out. In today's conversation, we basically touched a lot of hot topic issues, everything from women's health, fertility, population decline, insurance companies, the change in perception of medical providers, how to deal with being gaslit, the key phrases and words to use in an appointment. It is a packed full episode, so get ready, throw your headphones on. I think you're going to enjoy it. But before we dive in, quick housekeeping. If you haven't already, please follow, like, and subscribe, and send this to a friend that you think would love to learn a little bit more about what it's like to live with chronic illness and the things that we have to think about on a daily basis. One of my favorite things that we talked about in this week's episode was Dr. Nance's recent TED Talk. She did a deep dive in comparison of the stages of grief to the stages of misdiagnosis and walks patients through what that cycle looks like. And ultimately, I think gives everybody the permission to have hope that there's a light at the end of the tunnel. The mental processing that goes on with being chronically ill and ultimately getting a diagnosis or not getting a diagnosis. And if that sounds interesting to you, there's a link in the description below to go check out her TED Talk after this. My Alex's pick of the week have everything to do with a duvet day because I got to introduce Dr. Nance to what a duvet day even is. So for starters, you guys know I live, love, and swear by my Mayfair cozies. They have just crushed the waffle material. I have a insane obsession with waffle. Also eating waffles. Anyway, if you want a discount to go shop all of their cute little sets, Alexandra15 gives you 15% off at checkout. My second pick of the week is a wonderful robe for your duvet day by Weezie. I'm working on a discount code, so stay tuned. It'll all be in the description. You guys know how I do this because I have brain fog and I'm going to forget what it is anyway, if I even knew it right now off the top of my head. Okay, and I have one brain cell left, so to the interview we go. Hello and welcome back to another week of Calling in Sick. Guys, I have an amazing guest who you probably know from social media and all of her amazing advocacy work. Hello, Dr. Nance. How are you?
Hi, Alex. I'm doing fantastic, and thank you for inviting me on the podcast.
Oh my gosh, this is like the biggest treat of my life. Are you kidding me? I've been following you for a long time, and I just love how approachable you make conversations around health, especially women's health. So thank you for all the work that you do.
Of course. I kind of call myself an accidental influencer because it was not something I set out to do.
Yeah.
And to be honest, when I started my, social media platform, the reason why I started Little Misdiagnosed was I had gotten this DM out of nowhere, and I ended up solving this woman's 10-year medical mystery in 3 seconds over TikTok. And
wait, I had no idea.
Yeah, that's the first ever post on Little Misdiagnosed was me recounting this story. And I started a completely new channel. It was 0 followers, 0 posts. That was the first story I ever posted. And it went completely viral. And it had very little to do with the actual medical mystery, which was a glomus tumor and everything. But what I feel like is that so many people really resonated with, oh my God, no one's listening to me.
Yeah.
I've also seen 5 doctors and no one can tell me what's wrong with me. Everybody thinks it's all in my head. No one believes me when I tell them how painful this is. So that's when I realized that this was something that I didn't realize that other physicians were not speaking out on behalf of this cause. And that's when I started just sharing these stories.
Well, that is a phenomenal accident. That's probably one of the best accidents I've ever heard, honestly. So when you did start launching your social media journey and helping people navigate these really complex things. What do you think was the most surprising thing that came out of it that you've now been able to take as like a lesson or tool in how you practice medicine?
Well, for sure, the most surprising thing was, and this is more from like a content perspective, um, there are more likes for the comments of a video than the original content. And what I
Huh.
learned was that what really drives a video is its ability to compel people to add to the conversation. And
Totally agree.
I think what I understood I was doing really well was that even though I am by no means an expert in endometriosis or in MCAS, I could bring up the topic in such a way that made people feel compelled to, again, contribute to the conversation. And what I learned was that people were helping each other in the comments, saying, like, hey, I tried this, or did you get this, or have you seen this doctor? And what I noticed was that I feel like you do need, when we talk about like medical misinformation in general, like you do need that doctor's voice and that doctor's expertise, but that patient lived experience is also valuable, right?
Totally. Yeah.
You need to understand who the source of the information is coming from, but just because it's one or the other doesn't make one more right or one more wrong. You just have to understand, okay, this is someone who is, been trained in this area and has seen many people with it versus this is one person, their experience. It doesn't mean that's your experience, but you
Totally.
can learn from both sources of information.
I think that's completely right. And I think we live in a world that kind of like tends to write off things that don't totally like sit with the mainline story. And so when we do accept all of these different sources of truth, if you will, we get a really good picture of what's actually going on for a certain disease type, I think, be that the different patient experiences that are out there. And then we see, oh, someone can have lupus and it can look 500 different ways because of how their bodies are and, what kind of exposures they've had or what kind of medications they've been on, or there's probably a 25,000, I'm making up weird numbers right now, reasons why they're all different. And same can be said also for medicine, I think, where providers are going to have different experiences of interacting with those patients, specialists or primary care, functional or Western. And if we listen to all of them, there are truths in each thing.
Yeah, I mean, I actually just launched, it's technically available on the App Store, even though we haven't publicly launched it, but this platform called FeelBetr, BETR.
Woohoo!
When what we did was I had a bunch of interns. I have a bunch of interns sitting in the next room over now, but last summer I also had a whole bunch of interns. And what I asked them to do was to go through all of my videos, my misdiagnosis videos about certain disease topics. And I had them list out all of the symptoms that people in the comments were saying, they had lupus, these were their symptoms. And then I had them compare that to the symptoms that are publicly known on Mayo Clinic website
Ooh.
or WebMD. And we found that on average, there was 30% of symptoms missing from what is like the published norm for these diseases. Because again, so many people experience disease differently.
Yeah.
And not only that, but they may have comorbidities with different diseases that they can't separate out their lupus symptom from their POT symptom, from their
Totally.
MCAS symptom, right?
How could you?
Correct. So I think a lot of that is we are missing a lot of that information. And that's why I think social media really is so powerful in being able to capture so many different people's point of view.
I think that's really, really well said. And I love that you guys are doing that because when we think of listed symptoms or even side effects for medications too, those lists are created from populations that are relatively small. And then that is the textbook North Star gold stamp of approval of what describes a certain disease or certain medication. The amazing thing with the internet these days is that we can broaden that whole scope and actually paint, I think, a way more accurate picture. And that should give patients a lot of confidence and calmness that like not weird. They're not all by themselves on this island experiencing something that's just not listed online, but rather they're one of many experiencing this. And now it's just getting, I think med students and providers up that learning ramp too, to be like, oh, there is way more in this scope than we need to look at.
Correct. I see this all the time, especially with medication side effects and what's going on Reddit. Now, one of the issues that I have with the platforms that currently exist, TikTok, Facebook, Instagram, Reddit, is that these platforms were never made for or designed for talking about health issues and health conditions. All right. And I think most people understand that TikTok actually will push negative information or misinformation more than actually accurate information or credible information. But I will say, but I will say, on Reddit for the medication side effects, there are so many great threads of people who, if you asked, you brought that up to your doctor, like, hey, I just know because actually one of the users told me about this. It was a side effect for, I think it was like a common maybe anxiety medication, but the side effect was like strong sexual dreams. Okay, like
interesting,
totally like random. Probably something you're not gonna talk to your doctor about. Nope. But all of these people found each other on Reddit, and they're like, hey, I also have these really weird dreams. And if you get enough people, all right, now you can make that correlation to, it probably is somehow related to what is the common between all 100 people. We're all taking this medication. And so I think utilizing resources like a Reddit or TikTok, again, to help kind of, number one, reinforce that you're not crazy. This is a real symptom. This is something that could be connected to what you're taking. And then the task is, how can we get that information to your doctor so that you can work in partnership with your doctor to fix it?
And maybe that's like a great next question, is how the hell do you bring this to your doctor without saying, hey, I had this weird reaction to Humira and I went on Reddit and it seems like a lot of other people are also having that, without them laughing you out of the room?
Yeah. Well, to be honest, that was part of the main reason why I started FeelBetr, which I would call it a modern WebMD, because yes, if you go to your doctor and you say, I saw this on Reddit, they are not going to take it seriously. And so I wanted to build this platform where if you went to your doctor and you said, hey, I saw this on FeelBetr, that they understand that this is a credible platform where there is credible information being shared. So that's part of it, is actually creating the credible source.
Yeah.
Because in general, when people say, oh, there's so much misinformation on TikTok, that is true. But there can also be true that Dr. Nance is on TikTok talking about really credible information.
Yeah,
right?
Totally.
So a lot of times I tell people at this point, don't even mention the platform, okay? Because that's kind of just setting yourself up to fail. Yeah. And you just say, I have researched that there are a subset of people who are on Humira who have had this, symptom. I am also experiencing this symptom, and I'm concerned that it could be a potential side effect of Humira. You know, and start the conversation that way. So that, yes, when people come into my office and they say, I saw this on Google, or I saw this on, TikTok, I'm probably one of the few physicians who is not going to roll their eyes.
True.
Okay. But for most people, that is probably their experience, right? Is that they're going to have the doctor roll their eyes at them. So I think we have to understand that as it exists now, those platforms are not credible and trustworthy, even though there are conversations and creators that are credible and trustworthy on them.
I think that's a really good point, and a good distinction too. And hopefully, with FeelBetr and honestly like AI too, as it comes through and pulls together, I think showing if something's credible or not, we can have some progress there on opening that scope, showing that there's more patient symptoms, XYZ, and really like move the needle and help patients not feel so alone or isolated. or
Absolutely,
scared.
because that's the power of the internet, is using the internet for the scale, and
Yes.
being able to, and this is, I kind of have a love-hate relationship with Facebook groups, which is kind of what we're
Same.
trying to change, with FeelBetr, in that those Facebook groups started because Facebook was what was available, right?
And are
It
so well
was
intentioned.
correct. Yeah. No, I mean, the the problem, at least from the members that I have on FeelBetr, they tell me they feel like it's the sick Olympics. They
It is,
feel
and it's
like
negative as shit.
correct, and it's negative, and there are these admin like overlords who determine who can say what and whatnot.
That's wild.
However, there is a lot of really good information that is being shared in those Facebook groups, and people are finding community with people who they, up until that point, they never knew anyone else who had lupus, right?
Yeah, it's true.
So that's the other kind of major long-term goal with FeelBetr, is to become, again, that safe and trusted place for you to find others who have the same problem. To do that, you have to achieve a certain scale, right, of people who are on the platform. And that's why Reddit and Facebook and those things, right? Like, who has said that they enjoyed being on Facebook anytime in the past, couple of years? No one.
Sickos.
Yeah. So I'd say that I have this love-hate relationship, but in the end, I think we do need to evolve with the technology that is evolving with us, or we'll be left behind.
I think so too, and I'm really excited and super grateful and hopeful about what's to come, and thank you for what you're building.
Oh, you're so welcome. And you guys were, the reason why I built it is because I was getting over 10,000 emails, direct messages, comments a week from people just asking to share their story.
Yeah,
right? They're like,
people wanna
Dr.
feel
Nance,
heard.
will you share my story so that one person won't have to go through what I went through? And I think people can understand the difference between content that is made from a medical expert and then patients being able to share their experiences through the comments, through, those means. And as I said, I really, in the end, think we need a place where both the physician expert and the patient experience is accessible and valued.
I totally agree. It makes me really, really excited because I think we're at the cusp of a time period where patients are going to start feeling empowered instead of hopeless, instead of alienated. Like, we're at a really interesting juncture, which is great because there has been what I like to call a chronic illness epidemic going on, where it seems like the number of people facing and living with chronic illnesses just continues to climb. And whenever I tell people it's 1 in 3 live with a chronic illness, their minds are blown because everyone thinks it's so niche. Not that many people deal with this stuff. Most people are healthy. And the reality is most people are not healthy. And most people have some shit going on. Why do you think that's happening?
Yeah, I don't remember if I had made like a post about this or when I had this discussion, but there has been a lot of talk about the declining birth rate. Like, the declining birth rate because women are choosing not to have children, or women are, putting off having children, for their work. And I raised my hand and I said, people are too sick to have children.
Yep.
Okay. I go, that's what's going on. All right.
And it's not just women either. It's men too.
Correct. I go, they are having difficulty getting out of bed. And so there's so many more factors at play. And I really didn't like how it was always just reduced to like, women are choosing to have children later, women are choosing to, prioritize their career. In my opinion, what I am seeing is that it is too difficult for women to have children because they are experiencing, again, this epidemic of chronic illness.
Yeah, I completely agree. And also on that, the sperm health, fertility health, that has significantly declined in the last 10, 20 years. I think I know more couples than not who have struggled with conceiving kids, that have had to turn to IVF, that have had to turn to other things, or have just had their heart absolutely shattered that they cannot become parents. So I don't think it's just women are choosing to not get pregnant. I mean, I'm in that bucket too. If I could have gotten pregnant 5 years ago, I would have. I'm way too fucking sick to get pregnant right now. And there's no way I could have brought a healthy child into this world. And so I think that conversation, unfortunately, I think it's like a lot of loud voices and opinions from people that maybe deprioritize women in our lives and our rights and values that are missing the mark on the bigger picture here.
Yes. And I saw a post recently about some creator who had Ehlers-Danlos and her choice to specifically not have children because she did not want to pass on this potential, disease. And listen, this has been going on for there are people who have, other genetic disorders who this has been a conversation for a long time. But I think it hasn't, that's kind of been more like a niche thing. Like you have, I'm blanking on the name of the genetic disorder, but Huntington's disease, right? And the question was always, do you test your child so that they know that they have the disease so that they could make an informed decision for when they have children? And I feel like that conversation was always like very limited to the small group of people who had a fatal genetic condition.
Yeah.
Well, now what I'm seeing is that we just have an entire generation of women who are very sick and are reconsidering the choice of even if I should have children because they don't want what they're going through to pass that on to a future generation.
Totally agree. And it's actually something that I get a lot of comments on because I'm pretty public about how I do want to become a mom. That's something that like I've wanted my entire life. And also I have a degenerative form of vasculitis and lupus and endometriosis and blah, blah, blah. And a lot of people have commented, you should take a second thought on being a mom. Like one, just like passing that on to a kid, but two, like, can you even handle it? And I think, while they're always like well-intended comments, those are also like decisions that I have conversation I have super openly with my doctors. And like, thankfully my husband and I were super lucky and got to go through IVF before I did Cytoxin and test all of our embryos and see like, were any of them carrying or going to be predisposed to having some of my genetic issues. And thankfully, like we have 2 little embryos that are clear and completely safe from all of it, which is amazing. But in the same breath, anybody can have a kid. And with the current numbers of 1 in 3 getting chronically ill, anybody's kid can get sick. We live in an environment that is rich for disrupting so many things in our bodies that, cancer and unfortunately chronic illness is running pretty rampant.
Yeah. And I think that, again, like our leadership on this topic, and listen, when there's kind of been more of a trend for doctors to speak out and be more political. And it's probably one of my most viral videos ever was just a couple of weeks ago where I talked about a chapter in my book about how I helped take care of an undocumented worker. And so, doctors were being put into these like ethical gray zones all the time.
Yeah.
But when it comes to chronic illness, on one hand, you have an administration who honestly, for the first time, is acknowledging that chronic illness is a massive problem.
Yes.
Right?
That it's an epidemic.
That it's an epidemic. They are actually stating it. Yet at the same time, they are almost blaming us for allowing ourselves to become chronically ill.
And are funded by the people that are making us chronically ill. It is like the most cognitive dissonance I've ever experienced in my life.
So in the end, I think everybody wants to see people live happy and healthy lives to the best of their ability. But understanding that there are certain illnesses where you did not have a choice, where you do not get to determine the outcome, no matter how much you exercise or how healthy you eat or whatnot. And we have to understand that is actually a very large percentage of people. It's not some like small group of people. They're like, oh, those, people. No,
we very endearingly call it magical thinking in our chronic illness community of healthy people thinking that you can avoid getting sick if you do X, Y, and Z. And the reality of it all is like, that's just not how the cookie crumbles by any means. Chronic illness does not spare race, financial, gender, nothing. Like truly anybody can be impacted by this stuff.
Yeah. And I mean, podcasts like yours where you are giving voice to individuals and their stories and how, difficult it really is. And then inviting, people like me from, say, like the inside, right, of the medical world. It's because if we only talk amongst ourselves, then that is an echo chamber that leads to nowhere. Right.
Totally. Yes.
And so that's why I love what you're doing and kind of doing this like cross-pollination of ideas with people who could potentially bring additional visibility and like credibility to the problems that you are experiencing.
Thank you. That was the goal out of all of this, is that if somebody has questions or feels alone, that they can turn to this platform and find not just answers, but also hope. And hope can come from medical providers like you that are doing amazing work. And hope can also come from somebody's story that just resonated and sounded similar to them.
100%. I mean, that's probably the most flagged line in my book, is that hope is the most powerful drug.
Yes.
And hope can come from all sources. It can come from your doctor telling you a new treatment. It can come from watching a patient recovery story. There's so many sources of hope. And I find that really is what keeps people going.
It is. People ask me all the time, how do you stay positive? You've been sick for 25 years. And it truly comes down to hope. And there's been, I struggle with depression. And I'm super open about it. There's been times where I've had no hope. And any time that I've been in those spaces, there's been like a kernel or a moment or a video or a conversation I've had that has re-sparked that. And once you get that hope re-sparked, the world is your oyster. Like, you can keep on going just in times where you and anyone else in the world would think that's got to be the breaking point. And it's pretty amazing.
Yeah, absolutely. So a couple of months ago, I did this TED Talk at UVA, and it was called...
So badass.
It's called You're Not Crazy, The 7 Stages of Misdiagnosis. And I go through, because I felt like for people who had chronic illness, when there was a doctor, her name, the book is called On Death and Dying. And she created the 5 stages of grief. She created it in the 60s. It's, very, common. Everyone knows about them. And what I was noticing was that there were similar stages in misdiagnosis.
Yes.
And what it did was it gave people an emotional framework to understand, it's actually normal to feel anxious at this point. It's actually normal to have self-doubt at this point. It's normal to feel angry at this point. So I encourage anyone who, is on a chronic illness, journey. I think it's actually out now on YouTube.
We'll link it.
On TEDx, the 7 stages of misdiagnosis. But it's really to not only for you, but also the people in your life to understand what you're going through. And sometimes I think that's the most important person to reach.
I think it is too. I think it's the making our lives familiar, not normalizing, because it should never be normalized, but making it familiar to those around us in our circle that care for us, that work with us, that interact with us, so that they are able to be more empathetic or have more compassion for what we're living with. Because it's so easy to see somebody going through this day in and day out and just start to say like, they're probably used to it. And like, that's why we should never normalize this shit. Like, it's not normal no matter how many days you've been living with it, but familiarizing it is important, and frameworks like that help us navigate and share that.
Yeah, absolutely. I mean, the people who are in the audience who had chronic illness came up to me and they were like, this is life-changing. And then the people
so moved.
Yeah. And then the people who did not have personal experience came up to me and said, thank you. I had no idea.
Yes.
Right, that this is what my niece was going through, or this is what my girlfriend was going through.
Yes.
And that, to me, honestly, is the audience who should hear this message the most. Because the people with chronic illness, they live it, right? Yes. This is not a something that's, a revelation to them, but I do think it's helpful so that, as you said, help familiarize these patterns for them and their loved ones, so they can understand, this is how you actually get through a day.
Yeah, and it gives you also, I think it also probably plants a kernel of hope because then you see there's a light at the end of this tunnel. Maybe I'm at this stage, but I can see that if I keep working on this all and progressing and talking about it all, maybe going to therapy, I can get there. And that is world changing and paradigm shifting.
100%. And at the end of the talk, I talk about kind of some of the ways to divert out of those last stages, which
Ooh,
are
do
depression
share.
and apathy. I mean, number one is you must find your North Star believers. These can be family members, these can be doctors, these can be people you meet online. But these are people who make you feel like your fight is worthy, right? That you are worthy of finding a diagnosis.
Yes.
And sometimes it may be a doctor who is not even the right specialist, or they're not even going to be the person who's going to be doing the treatment, but they're the one who's saying like, I'm not giving up on you. I am going to help you get to the right person. Right.
Yes.
So like, that's the type of doctor that, the doctor who goes the extra mile, that North Star believer, I call them. And then to utilize the technology that we have that we didn't have just a couple of years ago. All right. On one of our earliest podcasts of the medical detectives, we interviewed a woman who she ended up using a technology. It's called Face to Gene. And long story short, we ended up crashing their website because I did a TikTok video. It went super viral, millions of views. All these people went to this Face to Gene website because what it does is you are able to upload a picture of your face and it can tell you within like a minute if you have a genetic disorder.
What?
It's absolutely wild. But the platform can only be used by medical professionals. So you have to, there's a barrier. Although there is a patient-facing part of their website, which I think you can go to. But anyways, it's called
Fascinating.
Face to Gene. I'm almost nervous because the last time I did this, we crashed their website in a good way, right? I mean, because I'm glad that this technology exists. Like
Me
this
too.
woman, like her whole life, I mean, this in particular was a very sad story, but she was like, my whole life, I was just told that I was ugly, that I was, had like a weird nose. And all along, it was a genetic marker for, a mutation.
Holy
Right.
cow.
Something that she could never change about herself.
No.
And so, yeah, like there are new technologies that we should be helping us, find out the root causes.
Yeah, and like supporting yourself with those things. I think it's incredible. Absolutely incredible. And when you said the providers that are your North Star, I had like 3 just pop into my brain right now that I'm like, I need to write them a thank you note sometime soon. I love them.
Yes. And I highly, highly encourage people to do that and to write,
Yes.
notes of thanks. And because sometimes even, to be honest, the doctors may not even realize the impact that they're having on you.
Yes.
And for me, a lot of times for the patients who they're coming to see me for a hand problem, but oftentimes I am helping them get diagnosis with things that have nothing to do with their hand.
Totally.
And
Totally.
they will come back and tell me like, you are the first person who ever even suggested I had Ehlers-Danlos or a connective tissue disorder. They'll be like, my patellas have dislocated 20 times and no one has ever once brought this up to me.
God.
I'm like, how could that be?
Yes,
how
it's
is
shocking.
that even possible that you've dislocated your shoulder 5 times or you've had a sprained ankle 10 times or something and no one has ever brought this up?
It's wild, right?
Yeah.
But you are right. Like giving thanks to those doctors, I think is really important. So I grew up with my dad being in the medical field. He's a pediatric urologist and surgeon, and he's phenomenal at what he does. But I grew up with all these little kids, like making my dad art and having these really precious little thank you notes. And so that was always top of mind for me that when I was an adult, well, I mean, I was sick when I was little, so I did that then too, but carried that on through my adulthood. And that's truly like bonded me with those providers more than I can admit, because it's weirdly enough, it's a thankless job. Medicine is so overwhelmed right now. Providers are bending over backwards. There's this weird backlash by some public name or by some like of the public that is almost like anti-medicine or just so takes all of their anger out of their own journey onto medicine as a whole. And the whole thing is just so much bigger than that.
I mean, when other doctors ask me like why I'm on TikTok or what I'm doing on TikTok, I go, do you know that my most common comment is thank you?
Yeah.
Okay.
How often do you hear that in the clinic?
I have been thanked 100,000 times. All right. And so
I need this today.
Okay, I'm like, this is the best place for us to be. I go, people are actually really, really thankful. And I get it because it is really hard to practice medicine.
It's really hard to practice medicine.
For a lot of doctors, they don't want to sound like they are complaining, right? But at the same time, it is much different to be a doctor today than when your dad was practicing when you were a kid.
Yes.
Right? There has been a enormous shift in, I would say, the social benefit to being a doctor, right?
Yes.
Okay. And that's things that are like intangible. We're not even, don't even get me started about the pay, how we're actually paid 30% less than we were 20 years ago. But we didn't just go into medicine for money. Okay. There's absolutely no way any doctor did that.
There's way too much school required and debt required and sacrifice. I mean, I didn't see my dad the first couple of years I was alive because he was in residency and fellowship. He did not miss any appointments, any violin recital, nothing ever, but he was gone during the day and he would go back to work after dinner. It was grueling.
Yes.
But he did it because he was helping people.
Correct. And listen, someone just sent me a text a couple of hours ago that is a research study out of UVA that said only 47% of Gen Z trusts their doctor. And the article was about how they trust TikTok more than their actual doctor. And to me, the number is not surprising from just what I kind of see and
you
read
see
about.
A bird's eye.
But that is scary.
It's terrifying.
A very scary statistic. Last year was the first year that doctors had less than 50% like favorability rating when they do those like polls and things like that. Okay. Like that is wild. Like that is wild to me. Like we are not your enemy.
No.
And I think that part of this is that it is really hard to have a great interaction with a doctor, right? Where you get what you need, you got the diagnosis, they put you on a treatment, it worked, right? That's like a golden path. And we talk about this on our podcast that I think we have to kind of change our expectations.
Just about to say that.
Okay. For what can actually happen in a doctor's appointment, right?
Yes.
If you go to the emergency room with a chronic illness, you are not going to leave that emergency room satisfied because they are not going to be able to help you. All right. Now that is different.
And they're not going to diagnose you.
Correct. They are not going to diagnose you. Now this is different from someone who has chronic illness and is having an acute pain flare up. Right?
Totally agree. Yes.
So we have to understand like what are the adequate places people should be going. Yeah. But this gets back to, well, they tried to see a rheumatologist, but the next appointment is in 18 months.
Yep.
So I understand why people may say, well, like, I had no other choice but to go to urgent care or,
Yes. You go to a primary care doctor, but all of those providers know a mile wide and an inch deep. Like, they're also not going to be able to help you. Or if you go to a rheumatologist, they're not going to be able to necessarily help you with your gastro problems or your neuro problem. Like, those are then a mile deep and an inch wide. It's so hard to be a complex chronic illness patient because we have so many systems going on that you just can't go to one person to fix it all. And I think that is like the hardest mental disruption when you get into this pipeline, because all of a sudden what you thought was going to be the journey of see a PCP, get referred, go get help, get on a medication, feel better, is broken.
Absolutely. And I will tell you, when I was a resident, when you took in a new inpatient from the ER, most of the times I would say the majority of people were healthy. 22-year-old female, no PMH, no past medical history. That was like the most common thing. Every once in a while you would get 55-year-old male, history of CAD, chronic,
Kidney disease,
arterial disease, hypertension, status post-cabbage. And it would be this like one long run-on thing. And you're like, oh my God, okay. But now I feel like it's the reverse, where now it's rare to find someone who is a no PMH person in their history. So things have significantly changed.
Do you think that's because patients aren't getting admitted into the hospital for next steps from the ER, or do you think it's because there's just such an influx?
No, I think there is. Every year it's compounded. There are more even diagnoses, right? There are more diagnoses that there were 20 years ago when I was practicing.
New names.
Correct. So that's certain, like if you test for something, you're going to find it, right? And that's kind of what they figured out with autism. Why is there this huge spike in autism? It's because they broadened the definition of the diagnosis, right? Okay.
Yep. More research. It's wild what happens with that.
Correct. But in the end, perhaps 20 years ago, people were just like sick, right? They didn't have a name for it. They just soldiered on. And now I think we have a more vocal, a more empowered younger generation who's like, I'm not satisfied with just saying, like figure it out. Right?
Yeah. Yes. Which is great. But I don't think the system's quite there yet to meet it, but that doesn't mean it won't be. It's just, I think that has to be living in the back of our brains, that when you go into an appointment, you're not going to get all of your problems solved. And that's why I always say, like, I have a anatomy of like an appointment card that I always like to talk about, which is you go in and you have a primary goal and a primary concern. And that is what you are focusing your 15 to 20 minutes on, not your laundry list of every single symptom that's going on, because one, that's also incredibly overwhelming to the provider to be like, we have 20 minutes, how the hell are we going to get through all of this? Focus on the one thing that if that changed, your quality of life would improve that much more. And I think that actually like changes the dynamic of the appointment and gives the patient more hope and a better expectation of what could come out of that appointment.
I absolutely love that because, as I said, I'm like a super subspecialist, right? You chop up your hand, I'm putting it back on. So when you're dealing with more your like primary care people, that's exactly the route to go.
Yeah. Okay. Last question I have for you. What do you wish more of your colleagues understood about the female patient experience?
I wish my colleagues understood that we have not done an adequate job of researching women when it comes to how they experience diseases.
Yes.
And that the symptoms that we have been taught as the symptoms may not apply, or they may show up differently in women. And so we have to kind of broaden our, thinking as to like, okay, and this, I say this all the time. If you are a 50-year-old woman and you go to the ER and you say, my chest feels tight and I'm feeling difficulty breathing, they're going to tell you you're having a panic attack and send you home. All right. Versus if you're a 50-year-old man who's getting an EKG and a troponin level to make sure they're not having a heart attack.
Yep.
All right. So that's not to put down ER physicians or whatever, because they themselves have seen this pattern over and over again where people present with panic attacks. Okay. But unfortunately, you have to understand that you cannot generalize that to women as a group.
100%. It almost brings it back to what we were talking about at the beginning, that this is the power of the internet right now, is it's widening the scope. It's saying, hey, we know X, but guess what? There's this whole bucket over here that we're just learning about, and it's time to pay attention and learn to this part. Okay, to wrap it up, my favorite thing to do is duvet days. I talk about them all the time online. A duvet day is the way that you are able to fully give yourself over to rest without guilt. You curate an entire itinerary of a day that is just self-care so your body can rest and recuperate the way it needs to. During duvet days, I like to binge TV, and I always need recommendations of what to watch. So what is your current favorite TV show or movie that has your attention?
Well, I have always been a Bravo fan. Okay. Like,
Same. I knew I liked you.
So I have always loved, pop culture. When I was in med school, my husband got me a subscription to Us Weekly. I had that subscription for almost 20 years. All right.
Good husband.
They were like, actually, we're not printing magazines anymore. So I always love pop culture, and because I have a summer house, I like to watch Summer House. And
hell yes,
that is
great
my
show.
guilty pleasure. So,
great show.
Yes,
I wish Paige was staying on. She's iconic. I love her. Heartbreaking news.
I think she needed something more to do.
I think so too.
I think she wasn't being utilized fully.
I would have to agree. So, she's going places.
yes. So good for Paige. But yeah, I love Summer House, and then I love like driving by the places that they go to, and like, yeah. So that is my recommendation.
That's a great one. They also talk a lot about health and mental health on the show, which I think is really, really nice.
They have, which is amazing to really open up those conversations. Yeah. They've talked about fertility. They've talked about mental health. They've talked about substance abuse. Yep. And because it is a reality show, you're seeing it like play out in real time. And I love that they are doing these kind of deep dives into things because health is part of their story.
Yeah. And it's familiarized people that it's okay to not be okay. Well, thank you so much for being on the show. It's been such a treat. And thank you so much for everything that you do for my community and population. You're part of the group that is just moving the needle forward and helping improve our lives on a daily basis. So thank you so much.
Oh, thank you so much. And I would be honored to have your audience as some of our first FeelBetr users. And it isn't even public yet, but I would love to have people on the platform. It's FeelBetr, BETR, because we want to hear back from you and get you, part of the conversation.
100%. We'll put all of that in the description so you guys can find the amazing platform, and we'll have links to all of your pages so people can connect with you after this.
Thank you so much for having me. It was awesome.
Awesome. All right. Love you guys. I'll see you next week. And that's a wrap. Thank you so much for joining me for another week of Calling in Sick. As a reminder, I would love for y'all to like, follow, subscribe, save, share with a friend, do all of the things. It truly helps grow this community, and it helps these episodes reach the people that need them the most, whether that's for an educational piece, to have a little laugh, or to not feel so alone. As a reminder, Calling in Sick sits on YouTube, Apple, and Spotify, and anywhere else where you can find your listens. From the bottom of my heart, I absolutely love you guys. Thank you so much for calling in sick with me every Monday. It's been an honor and a pleasure so far, and I can't wait to continue. I can't wait to continue building this community with y'all. Love you.